fancy.
Well, welcome back to the podcast. I'm your host, Ben Imes, exploring the depths of healthcare. We've got another great episode for you today. Interviewing one of our more esteemed guests from the Pacific Northwest, Dominique. Dominique, why don't you introduce yourself, who you are, what you do, why you're here?
Yeah, I'm Dominique Edwards. I own a psychiatry private practice in Seattle, Washington, and it's a group. So we have another nurse practitioner working. I'm also a nurse practitioner and an ADHD coach as well. So hopefully we'll expand and add some more prescribers. But yeah, so doing the
Very
group
cool.
practice life.
Very cool. And so, how did you? So you're trained as a nurse practitioner, and
hmm
then you probably had to do extra training as a psychiatric nurse practitioner.
Yeah, I did like an accelerated program
Okay. Yeah.
so I have a bachelor's in psychology and
Okay.
yes. So at Vanderbilt University School of Nursing, you can go in with like an unrelated bachelor's, just like of any type. I just happen to do psychology, and it's like an accelerated, but it's pretty intense. But the first year you become like a bachelor nurse, like RN level.
Mhm.
And
Mhm.
then the second year is your specialty. So you kind of choose your specialty up front and then transition into that for the second year and go hard for that year. And then you're done basically. So it takes 2 calendar years, 6 semesters.
But it's crushing 2 calendar
Yes, yes,
years.
and you have to be sure it is very, very hard to, like, switch your specialty
I was gonna say,
during, so you kinda have to apply with your, like, 2-year plan already locked
right,
in.
and knowing kinda what you're interested in already as you go in.
Yes, yes, and for psych, I feel like it's easier to know, but with the other specialties, it can be kinda hard, like, do I wanna work with kids or not? Because
Right,
like, in psychiatry,
or
you
family
just, like
medicine, yeah.
yeah, you just have to figure out, do I like mental health or not kind of thing.
Well, I mean, and it's true, but, like, even with mental health, I mean, then you open a whole doorway and it's like, Pan's Labyrinth, it's like there's so many choices to choose from of, like, what you're gonna
Totally.
specialize in. So
Yeah, kids, adults, teens,
totally.
everything, and
And
patient
then
out.
everything specific, like, I'm gonna be the bipolar person. I'm gonna be the schizophrenic, like,
Yeah, yeah.
dealing with that different populations. So, how did you land on where you're at now? Like, was it just by chance or
Kind
interest?
of. So after school, I did loan repayment in like a pretty high needs area in Seattle. And so that was like a lot of like severe mental illness, just like the nature of it, the clinic. And so I got like definitely trial by fire once I graduated, but then wanted to move into more like private practice because it's just really hard to do community health like long
Right,
term,
right.
like on your own psyche. So yeah, I
Yeah,
ended up at an
it burns
ADHD.
you
Like,
just helping others.
yeah, it's intense though.
It is.
Yeah, it's called CMAR. So there's like a lot of non-English speaking folks. So it's like two dimensions of like translation and clinical like practice in one appointment. I'm not translating, but you have like a translator there. And so there's like cultural norms and stuff that you're like considering. And then maybe like houselessness too on top of like finances. And you're like, okay, I think I'm gonna choose this medication. Like like doing like internal math. It's
Right.
really hard. But
Yeah.
anyway, so and then I ended up at an ADHD specialty clinic, which I really enjoyed. And I was like doing that on the weekends. And then I actually ended up getting tested for ADHD myself as an adult. And it all kind of like found me together. It was like definitely like a passion population that found me. But I don't know. I feel like it kind of worked out that way, which is kind of
It
cool.
pulled you in a sense.
Yeah. And I have a lot of friends with ADHD. And I'm like, okay, things are starting to make sense, like the way that we think and like
Yeah.
bop off each other really quickly. So,
Yeah.
yeah, it's a joy definitely working with patients like that. So, I mean, it's just kind of like talking to friends.
Yeah. You're
Yeah.
like, "Hey, I know how your mind's tracking. You're jumping, you're jumping, you're jumping.
Yeah,
I
yeah,
got it. I
yeah.
got it."
Yeah, and I'm like, I'm trying to keep us on track, but like I might be jumping too, so I'm trying to just let's work together.
Are you working a lot with, now pediatrics versus adults or combination?
Yeah, we do both at my practice, but I feel like it's more adults, honestly, because we have like the more specialty experience of like because so like traditionally ADHD, they think about it in like hyperactive kids, and a lot of them honestly were like hyperactive white kids, boys. So now that like I have the specialty experience of like diagnosing adults in their like 30s, 40s, 50s, it's just a different presentation. And so I feel like we're kind of attracting more of that profile because we have a lot of experience with it. And also like diagnosing like cis women,
Mhm.
it's just like a whole different like societal like trajectory that you've like seen across your life and like how it's going to present for you. So,
Right.
so I feel like I'm getting like a lot of adults maybe for that reason. And also like it looks different too if you're like black and brown and like there's different, like, cultural, like, family
Sure.
histories on how it might have been missed or things like that,
Sure.
but also kiddos too, so but
Okay.
more adults for our practice.
Now, for my listeners' sake, I mean, give them a little like, I mean, as generalized as you can without describing a specific patient, in the adult population who's coming in for the first time and you're working either have already established an ADHD diagnosis or you're kind of working through the initial stages after diagnosis.
Mhm.
What does that look like? I mean, how does that present? What kind of challenges are they presenting with and that are kind of leading you towards considering, treatment plans?
Yeah, it's so usually they're presenting because they have been trying for so long and they've been keeping it together for a while and then they're just completely exhausted and burnt out and wondering like I can't do this anymore, like something's got to change. And usually we can like retroactively see the signs. So they might be like academic high achievers, which people used to think like you can't have ADHD if like did really well at school, but it can actually just be like anxiety that's been propelling you through school,
Okay.
this
Okay.
long and then you graduate and then go into your first job or start a family, everything's kind of like crashing down because you don't have like the external pressures anymore on you that would
Right.
like fuel your anxiety basically. So
Mm,
there's definitely a lot of ways to mask without even knowing. Like intelligence and ADHD are completely independent. So you could just be like really gifted at like a certain subject matter and have no idea that like it's coming easier to you because you enjoy it. But like once you get like into like other things, mundane, like adulting, it just kinda catches up with you and you're like, "This is not like, I can't get motivated, I used to be able to." Yeah,
so
there's,
it's
like, a lot of
very
different ways.
different, kind of a big spectrum.
Yeah, definitely, and ADHD itself is a spectrum, so it could be, like, struggling with paying attention, like, while you're driving, like, as acute as that, like, getting into accidents without your medication kinda thing,
Wow.
or yeah, I've seen that before, for sure, or it can be just kinda like white knuckling every day, like, why do I, like, have to, like, put, like, 10 Post-it notes, like, on my mirror, like, kinda thing, like, what's going on here?
Yeah. And
So,
I
yeah.
can't get any of them done because I'm too
Yeah,
overwhelmed
now
by
I'm overwhelmed because, like, I see them and then
that cycle that keeps returning.
definitely. Yeah,
So
so there's a
okay.
lot of ways that it can, present that might not be, like, super typical, but a lot of people are, like, under the impression that you had to do bad in school, which is not the case at all.
Right. I mean, yeah, I think some people that I mean, some of my friends, ADHD diagnosed and brilliant. I mean, but
Mhm.
more of, and maybe this speaks to it from what you're talking about, but more of it's the possibility of I just don't want to fail. Like
Yes,
I
yes.
want to do so well, or I don't care to do so well, but I'm just terrified of failing. And so I
Yes, it's like
must
that
run at this.
achievement. Like, in some families growing up, like, when you achieved, you got attention, had more positive interactions, and so you're kind of, like, working harder than everyone else to get, like, the same results sometimes if you do have, like, the ADHD brain, which is, like, over time exhausting, no one can keep that up.
But yeah, you can just get burnt out very quickly.
Yes, definitely,
What
so
what kind of, therapeutic things are unique to your practice and kind of what you've developed over your career, and do you see being very effective with your patients?
yeah, so ironically, even though we're a psychiatry practice, like so we do medications for sure, but we also try and, like, de-prescribe, I guess you could call it, so, like,
Cool.
as little medications as possible to get, to the same result and, like, making sure that people feel like themselves, which usually comes with, like, the lowest dosage possible and not interacting a bunch of things for no
Right.
reason. So that is newer, I would say. So, like, using maybe, like, movement or exercise in addition to, like,
Okay.
Ritalin, which is methylphenidate. I think you froze a little bit. Oh, you're back. So, like, you can get away with lower doses of medications by, like, adding in, like, a movement routine for your day or something adding in magnesium or, different supplements can help with, like, side effects and things like that. So, I think we're more integrative than
So being more holistic
yeah.
ish.
Yes, definitely. So, like, there are other ways to get there besides just, like, maximum Vyvanse doses.
Right.
Yeah.
As well as, like, adding maximum Vyvanse on top of whatever else is already in the cupboard, you know?
Yes, exactly. And that's why I wanted specifically an ADHD coach to work with us because we don't want to like increase our meds to infinity and beyond. And when you've been diagnosed as an adult, usually there's some type of habits that you might not realize are like ADHD like or ways that you've like gone through your life that are really effortful,
Mhm.
like that, you just don't really know because like you don't know that anyone else isn't doing it until you like realize. Honestly, it's when people start living with partners sometimes where like it's like reflected back to them and they're like,
They see the
"Hey,
mirror.
so that's not what I do with my dishes."
They're
Or
like,
like,
"Is
yeah.
this bad different or is this just normal different?"
Yeah, you don't really know sometimes, especially if your whole family has ADHD too. That's just like the culture, whether they know it or not. So, but yeah, so we added a coach, which I feel like is more rare to have like a coach embedded within like a medical practice.
Totally. It's the first time I've heard of it, so it's
Oh,
unique.
cool. Yeah. So, and I chose someone specifically that wasn't just like a self-proclaimed coach. So,
Well
yeah.
done.
So she is a neuroscience researcher. So she actually like pays attention to like how the brain, like learning and memory works, and then like applies that research. So, because I know it can be a little bit dicey, the coaching title, and we all collaborate together. So we make sure that like clinically she's doing cases that are appropriate for coaching, and if not, we can refer in house to like licensed professionals. So
Oh,
it's kind of
cool.
a cool dynamic because we can see people throughout the United States with coaching. And then the more licensed services are Washington centric. So we can't reach as many people.
Sure, sure. It's a very integrated plan, it sounds like you guys have. And
Hmm.
what kinda pushed you to I mean, we're gonna get to this posthumous we will get to this of how you went from being an employee of a clinic to developing your own clinic, but how did you think of bringing on this coach as part of your kind of integrated plan with your patients?
Yeah, I think just through experience, like the
Okay.
more you do meds, the more you realize that like something is missing. Like it's not gonna be I mean, sometimes it is night and day when we start a medication, but usually over time there's still like things trickling in the background that can be like optimized or
Mm,
made easier for someone. So I think the longer you prescribe, the more you're like, I'm not convinced that this is it.
sure.
So yeah, for me it was just utility and that's just how the body works. Like
Yeah.
yeah.
It's also
Everything's
what you see.
connected, and there's probably more than one reason why we're seeing this certain thing, and so we're gonna just be true to that.
Yeah, and it's like what your experience is, you've seen good outcomes, poor outcomes, and kind of reading that correlation,
Mhm.
being
Yeah,
able to
definitely,
adjust.
like, the ones where we use, like, therapy, coaching, medications, and, maybe even spiritual, like, whatever you like, works for you personally, those do better when we, like, do multiple
Wow, that's really
interventions,
cool.
for sure.
Well, kind of building off of that, so now we're gonna get actually to the question, but how did you go from employee to employer in a sense? Like, obviously, you're your
Yeah.
business practice owner, but how did you go to
No,
that route?
definitely. Out of necessity, like, I asked for a raise, and they were like, "Well, we can't do it," and I was like, "Well, I can't do this, so I guess here we go. We're just gonna."
2 feet, here we go.
Yeah, and that's a lot of things in my life find me that way, like, I probably would if they would have given me the raise when I asked at the other private practice that I used to be an employee at, I might have stayed there and still be there. I'm glad that they didn't now, but you can't unsee the numbers when you run revenue reports, and I
Oh,
was
yeah.
like, "So you can, and therefore I will be leaving."
Yeah. I know the margins here.
Yeah, and I know what I work and, I always had really good relationships with clients and would enjoy they would be like other clinicians would hear us, like, laughing through the walls, and I'd be like, "Sorry, we're just having a good time." I don't know. They'd be like, "Is that a psych appointment or what?" I'd be like, "It is, I promise."
Yeah, it is. We're just having a good time.
Yeah, yeah, so and they, like, had me take some, like, harder cases, and they were like, "We really appreciate that you do that, but also no," and I was like, "Okay, I'm gonna have to figure it out." So, 'cause I didn't, like, grow up thinking I would be, like, an entrepreneur or have my own
Sure.
practice, but I was like, "I will, be working for what I'm worth," so
Yeah.
there
Yeah, you value yourself at the rate you should. You know
yeah,
your worth, and
definitely,
so
yeah.
you stood up for yourself. So
It's
how
totally
did
worth it. It's a whole different, like, game of, running your own practice, but it's worth it for sure.
Yeah, talk about those first steps. I mean, the chaos of it all.
Yeah, I mean, a lot of panic and kinda back and forth. It took me, like, a couple of months, like, since stopping that gig to make sure that, like, I did wanna, like, actually start a practice. It took me, like, 2 or 3 months to decide, so that was, like, a lot of panic, and I was just one day I was like, "We're gonna do it, and if it doesn't work, then we'll figure it out." Um And yeah, I don't know, just diving in, you just have to really, like, commit. Some people do, like, part-time, they start their practice,
Mm,
and at the same time, they're, like, with their employer, but I just, like, because I couldn't do it was way too much, like, mentally to, like, have a full caseload with them and then build a practice on the side,
right,
because I was, like,
right.
working full-time with them, like so I just, like, clean cut, and then, okay, do I really let me, like, make sure that
Use that time
I
to
was, like,
clear.
kind of traumatized from, like, how many patients I had to see with them.
Yeah,
And now I have so much more time with my clients, and it is
it's
so
a
worth
better
it.
balance.
Yeah, it's
Did you
way
have
better
like
than
a
it's so worth it.
yeah.
And I'm my own boss, and I appreciate the work I do, so now my
Did
boss
you
appreciates me.
yeah, your boss is your best friend, actually.
Yeah.
Did you have, like, a mentor or somebody people you would reach out to kinda guide you along the steps?
Yeah, a little yes and no. I did have, like, some professors from my alma mater that told me how their practices were going back in Nashville, and that they were essentially they helped with, like, my confidence. They were like, "If you can graduate through our program, then you can have, like, your own private practice. Like, you can do it."
Yeah.
And in Washington, we have full practice authority, so we don't have to have, like, psychiatrists supervising us. Yeah, yeah, yeah. So that's really nice, and in Tennessee, you do, so I was even on better footing
Mhm.
being in
Yeah.
Seattle to start a practice. So they were like, "Yeah, like, you have the skills, you can do it." And I had, like, let's see, like, 4 or 5 years of, like, practice experience, and because I know some people are starting their practices, like, right after graduation, but I felt yeah, that's intense. I mean, it's good, like, for their, like, financial trajectory, but it's intense, like, clinically.
Yeah. What would you say were kind of the hardest lessons to learn initially and things you really did not enjoy and still maybe not enjoy about running
Yeah,
the
about
business?
business ownership or
Sure.
so I'm a cash pay practice. So this is an ongoing thing. So I thought if you build it, like they will come type thing, but not necessarily because they will go to their insurance first.
Yep.
And
People are
so,
trained that way.
yeah, and I get it. Like, honestly, like it is expensive. So for me, it's like a priority. Like, people are paying cash, like, it's going to be worth it. We're going to like pull out all the stocks for you. Like, I realize you're not using your insurance. I'm like very mindful of that. And so it's going to be worth every penny. But anyway, so when I first opened, I didn't have a website or anything, I just had, like, a Psychology Today, and I figured, like, that would be enough. It was not enough, so then I had to learn how to, like, actually market and talk about services and, like,
Yep.
who I was and that I even
Yep.
existed, and then I got a website, like, maybe 6 months after opening the practice, and it was just me for the longest time, so to be a business owner is to be a marketer too, which is interesting. Definitely if you're
Yep.
not taking insurance. If you are taking insurance, it's probably easier, but I don't think it's worth the trade-off because insurance is the worst.
Yep. Yep. Hassling with insurance probably takes up way more time, and that's time that you could be spending with patients or
Mhm.
going on vacation.
Literally, yeah, and not only that, but then they have the nerve to tell us, like, what we can and can't do, or
Right.
they wanna look at the charts and make sure we're, like, doing our job right. I'm like, "Well, who are you? Like, how do you even know?" Yeah, and so I don't contract with insurance for my services, but I still work with them to, get the medications approved for
Cool.
the
So it's like
clients.
a hybrid kind of model.
Kind of, yeah. I just talk to them as little as possible, but even the interactions that I have about the medications, I'm like, "Y'all are killing me." Like, I just think it's, like, kind of like a racket where we pay the premiums to these people, but they don't want to give us any services in return. They don't wanna pay the providers, and they don't want to cover any claims that the patients put in either. So,
It
why
just
do we even have it?
I don't know. Insurance is a whole nother podcast series I could start about griping
Yeah, yeah.
because everybody has the gripe with insurance. And, like, you know what you're worth, you know what you're able to bill and charge. I mean, I look at the
Yeah.
services, like, I work in the ER and I look at the services that I provide and the bills that I mean, I'm getting compensated like pennies,
It's laughable. Yeah, it's sad for sure.
pennies,
Yeah,
pennies.
we would do, like, psychiatric evaluations and get, like, $50 back or something, which is just wild, like, a full
Insane.
diagnostic, like,
Insane.
1 hour plus, like, these are hard. We went to school for a long time to be able to diagnose people and get them on the right treatment plan and, like, actually, like, listen to them and not just, like, cut them off, so, yeah.
Yeah.
I don't know, it's wild, so I just can't do it. I'd rather, like, have a small, tiny practice and be able to spend time with people and know that I'm being paid what I'm worth, and they're actually getting care that's not micromanaged than have, like, a huge bustling insurance practice.
Yeah, and rather than just saying, "Hey, your 20 minutes is up with your patient, you gotta now go chart for them while seeing the next patient."
Yeah, yeah, and the charting's for us, it's so nice, it's not for, like, an insurance company that has all
So
these
much better.
rules, and it's trying to claw they're literally just trying to, like, claw back their money is what's happening. It's just for us and the client to, like, make sure that we, like,
Yeah,
have
you're
everything
tracking everything.
documented. Yeah, yeah, it's like it goes back to the basics of charting, I'm like, "This is great."
This is how it was supposed to be made.
Yeah, it's literally just like my memory on paper, but nothing more than that.
That's so refreshing. I'm refreshed just hearing that.
Yes, yes, it's worth it. I will not go back to if you
So
see me
what
go
it
back to insurance, something is wrong.
Yeah, yes.
Yeah,
I'll call you out for that. How about
yeah,
that?
please do.
What do you think about I mean, so wearing the hat of a marketer, learning how to be a marketer for your own business. I mean, is that tedious for you or is that really something that you've enjoyed kind of being able to learn?
Both, I guess, like, the rewards are definitely there, like, if you figure it out and get your message across, like, then you get more and more cases that you enjoy working with and people that are aligned with you, which is nice, but it's a little bit tedious because I don't know, I'm just, like, self-taught, and so it's just, like, a long process, so it's a lot of, like, other podcasts, I love The Diary of a CEO. Do you watch that
Yeah.
one?
Yeah, yeah, yeah.
Yeah, that one's great, and yeah, it's granular, so I'm in different, like, SEO groups on Facebook, and yeah,
Stuff
I don't
that
know.
stuff that you weren't trained in grad school?
Literally, not at all. They were so grad school is interesting because they kind of train you to be, like, a part of the system, and it's like, I
Totally.
don't know if that's doing us, like, a service
I
as
agree. I agree 100%. That's like the underlying theme across all med school, PA school, NP school, any kind of graduate specialty of any type
yeah.
is like they actually want to push you as a system rat kind of thing. Like
Yeah,
that's the
it's
goal.
bizarre, and I even looked at into, like, if you were to work for the university itself, and they pay you, like, pennies on the dollar too, and I think they're just kinda, like, riding on their name and prestige, which is, like, cool, but, like, also there's groceries and stuff,
Yeah,
so that's not gonna work. I mean, it's cool to, like, work for Vanderbilt, say that, but, like, it's not cool to not be able to, like, travel and stuff.
100%. Or just like it's not I mean, you didn't suffer to just make ends meet, I think is the
Yeah, as, like, a master's trained
yeah.
clinician,
As
we're
like
like
I worked really hard for this and I have a unique specialty. Like
yeah, and I'm, like, good at it. It's hard to, like, be present with people even when, like, things are going on in your own life and, like,
mhm.
really give it your all, and there's, like, a toll on yourself, so, like, I'm not doing this for nothing. Like, I enjoy it, but it's also, like, it's not as simple I don't know, that sometimes I wish I had different, like, lower stakes jobs that, like
Mm. I
it's just a lot of pressure.
100% agree. I mean, me
Yeah,
me
yeah, as
and
someone in emergency medicine, yeah, you probably couldn't agree more.
I mean, I'm seeing the psych patients just not as gently,
Yeah,
I
not as
I should
stable.
say, not as stable.
Yeah,
But I mean, it's funny how often, we'll be on a terrible shift and, me and the attendings or the other PAs will kind of just look at each other and say, "Hey, are you getting crushed? Yeah. Are you getting crushed? Yeah. Man,
yeah.
why didn't we go into finance or something?"
Like, literally, literally. Sometimes I mean, in corporate, it's like I mean, people aren't dying because 'cause I've seen, like, some TikToks where they're like, "This isn't life or death, like, everybody calm down." I'm like, "It
Yeah,
kinda
chill
is
out.
for us, so, like, we're not calm."
Right, right. How do you expect us to be calm, like, when, you work let's say you work 5 days this week, you saw however big your panel is, and, you know, 30% of these people are active like, have active ideations,
Mhm.
and
Sure.
you're, like, having to talk through that with them. I mean,
Yeah.
okay, then I'll just disconnect and, you know, hang out with my friends and
And that's, like,
laugh
a whole
and go
'nother
to a
skill. They
party.
really should teach you that better too, like, you really
Yeah,
have to balance and protect yourself.
yeah,
I was
I
talking to
agree.
someone, another psychiatrist or a psychiatrist, and what did he say? You can't set yourself on fire to keep someone else warm. So,
Hmm,
like, yep.
I like that. I like that. Do you feel like you've found better balance, being your practice owner and kind of as this thing has developed?
Yes and no, like, for appointments and, like, the technical work, yes, but it's interesting figuring out because like, when you start to add on people, now you're, like, managing other humans, and so then you have another job, so it's an interesting thing where jobs just, like, appear out of nowhere. Like, now I'm a marketer too, and I'm like, "Okay, well" it's a trade-off, and you have to, like, really be good about, like, "Okay, I'm gonna stop," or if anything, you work too much on, like, all the other
Oh,
things that
yeah.
you're not necessarily getting paid for either.
Yeah, and you better I mean, think about how many meetings you have. You gotta manage people now that you're growing, and it's like,
Mhm.
managing people can be difficult. Not everybody's
Yeah,
like
like a whole
it
nother
it's a
thing.
it's a whole 'nother realm of, like, "Ha we're working together here, but I'm also your boss, but I'm also, like, wanna be your friend.
Yeah, yeah, but I, like, built this from scratch, so please don't mess it up.
It's my baby, don't hurt it."
Yeah, literally, like, I've given up a lot for this, so,
How have you seen so How long have you been open now?
Since 2021. Yeah,
2021.
about
So
4 years.
post COVID, kind of come out, Phoenix rising from the ashes.
Yeah, kinda midway where it was still a little bit weird for, like, people to come in the office and stuff.
Sure.
Yeah.
Sure. You've hired other providers, I think you said at this point?
Yeah, one other nurse practitioner, hopefully more soon to
Okay.
help, see clients and yeah.
Because of like to meet growth needs or like because there's more like cases that you would like to take on, but you guys are already over kind of
Yeah,
burdened?
both. Also to meet, like, internal coverage
Well,
needs
good point.
because, like, yeah, the fewer clinicians you have, the more that work that everyone has to do,
Yep. Yep.
and which isn't sustainable, so, because I would have been, like, a solo practice into the night forever until I realized that, like, it doesn't end. So,
Yeah. Good
you
luck
need
taking a
help,
vacation.
yeah. Yeah, I was like, "Oh, wait, okay, so this is not the model that I wanted because you wanna, like, have more freedom than you had working for someone else and, like, more flexibility, and that comes with, like, other people who can, like, prescribe and cover for you and
Yeah.
triage and stuff.
So you're like, I have to scale this to have good balance for everyone as well as
Literally,
myself.
yeah, it's like it feels like you have to go through to or what is it? What do they say? You have to go through to get out or whatever.
Go through to get out or go. I don't know. I
Yeah,
know
it's
the
like, but
idea
this
you're
needs to
trying to
grow in
communicate.
order to, like, shrink my responsibility because I have to, like, delegate it.
Oh yeah, 100%. And that's not a I mean, that's delegation is also a skill you have to continue to learn, like in ownership, because you could, I mean, you absolutely could just take on every role and then
Mhm.
you wouldn't have free time. And any
At
weekend would
all,
be
or
taken.
sanity. That's not good. You don't want someone that's unstable helping you with your mental health.
They wouldn't be present, like you said. And that's the goal
Yeah,
of
yeah,
starting your own practice, be present.
totally, and people can tell when you're, like, talking to them and you're, like, somewhere else, or sometimes I'm surprised at people who just, like, chose psych, like, they don't seem to like people very much or, like and I'm like, "Okay, that's an interesting
Or they're
expression."
not good with people.
That too, but it's hard to know, like, how do you
Sure.
know if you are?
Ah, good point. Well, I guess you work off of feedback.
Yeah. Well, you know what? We'll give you feedback, a cash pay practice because people will not pay you cash if you're not good.
True.
They will go
That's how
somewhere
you know.
else
They keep coming
immediately.
back.
Yeah, yeah. They like, immediately, which meant, like, I paid cash to my therapist for a while, and I was like, "Okay," like, as the consumer now, I totally get it. Like, she's good.
Yeah.
She would have to be good.
Yeah. I mean, because it's your money being spent. People don't quite act the same way when it's insurance based, I think.
Not at
I think they
all, and
just
they're not as engaged either. So it's kinda cool to have cash pay clients because 'cause they're like, "No, I wanna get better," and I'm like, "We got you."
they're
They're, like,
motivated. You
ready.
can
Yeah.
yeah, you can come alongside them.
Yeah, yeah, and some of the insurance I mean, if your copay is, like, 25 bucks, you don't necessarily have to be invested. You're like, "Okay, I'm just gonna, like, try this," but it's not the same level of commitment.
Yeah.
And it's even sometimes you don't have to be here. We don't wanna, like, force anything because I used to
You
take
came to me, but, I'm just available.
yeah, like, "This isn't court mandated," like, "You don't have to come." But, no, for cash, they're like, they wanna be there for sure.
I see. I see what you're saying. Well, what are some like words of wisdom? I mean, for the different people, the different providers who are under the thumb of the hospital system and,
Yeah.
kind of just the burnout central. What are your kind of words of wisdom of maybe giving them like a sign of hope or, encouragement that either continuing their path but just finding better balance or starting
Mhm.
their own business? What are some kind of like things that you've learned that you wish you could pass on?
Yeah, and not everyone wants to start their own business, I get that, but I do think one thing for NPs is to invest in at least one full practice state, like, get licensed in one full practice state if you can.
Mhm.
Because if you are, like, always under it's just, like, oppressive to have, like, supervised I don't know how you feel as, like, a PA, but, it's restrictive for sure. I think if you can invest, you don't necessarily have to have your own business, you could just, like, moonlight and see clients on the weekend for someone, but
Right.
telehealth, as long as you're not, running controlled meds, but invest in a full practice, try and change the laws if you can, but I don't know, some states are pretty, like, anti full practice. I don't know, it's weird. Some states are very I don't know if it's, like, the doctor lobbyists or what, but they really don't want NPs to have power.
I wish it could just be not state-based, just very generalized and yeah.
Yeah, we have, like, 50 different countries out there in the
Yep,
United States is what it feels like,
yep.
the rules are so different everywhere, but that's probably my favorite thing about working in Seattle and Washington is the freedom you
Mhm.
have, and so, like, once you, can work on your own terms, I feel like everything kinda, like, follows from there, and that's based off of your licensure, in my opinion.
Yeah. No, it's very cool. I think it can continue to I just hope more states kind of agree to kind of start changing things up. I mean, multiple different like I'll call it APPs, advanced practice
Mhm.
providers that I've talked with have a similar mentality or the gripe of, "Oh, I work in Texas, so I have to have a supervising physician." And
Yeah.
that relationship can get sticky and,
Yeah, and I get it if you, like, live there, but maybe try I think Colorado's a full practice state, right, for
I
NPs?
think so.
Yeah, just try another state virtually and, like, see what you think, like, side hustle, like, gives you a little bit more extra money, then you get a taste of freedom.
And you can get an idea if you actually wanna, like, rather than your story of jump 2 feet at the same time and go all in.
Yeah, I really wouldn't I had savings and everything, so I
Sure.
wouldn't recommend if you don't have savings,
Other
but
people maybe can dip their toes in the ways that you're saying, though.
yeah, for sure. Yeah,
Yeah.
exactly.
Well,
And
very
not
cool.
like I mean, I've really committed, so sometimes it's like, "Okay, well, I'm a little bit too far," and sometimes it's nice to not be, like, all in. Exactly, yeah, it's like, shut it down or keep going, and we're just gonna keep going.
Yeah, keep going. Well, I hope the best. I hope the best comes. Where can my listeners kinda reach out to you if they're interested, if they're listening in Washington State,
Yeah, yeah,
or wanna
definitely
learn about
visit our
more?
website. It's edwardspsychiatry.org. I do free consults with anyone in Washington, or if you're interested in coaching, anyone can reach out
Cool.
for that. But yeah, I do free consults. I like to welcome everyone into the practice. I don't do like a ton of like ongoing clinical casework right now because I'm working on the business, but I'll get you to like the provider that's the best fit for you. And then we can talk about coaching too if you're in another state and curious about it. But you
Super
don't have to
cool.
have an ADHD diagnosis for coaching too. It could just be like, you need help, like hacking your life type thing, and we can still help. So,
See, that's a very unique value, and so I hope my listeners can kinda pass around your knowledge and your expertise and kinda your connections in that way. That would be really cool.
yeah,
Glad you can
yeah,
offer that.
awesome. Thank you. But yeah, website's the best place. I'm still kind of working on social media presence and everything, but I think website is good.
Sure. Sounds good. Well, I'll attach that to the, show notes, and they can find you there and kinda connect from there.
Okay,
Dominique,
wonderful. Well, thank
thanks
you. I
for your
appreciate
time.
it. Yeah, my
Yeah, I
pleasure.
really enjoyed our conversation. Really, grateful that you could join today.
Likewise. Yep.
All right, we'll talk later.
Okay.